All metabolism depends upon is a cell that is making energy correctly. So we hear a lot about slow and fast metabolism, right? There are a lot of people out there that are having their cells not work well. So that's down to the mitochondria, the nucleus, and also the cell membranes are very important. And that's what's leading to the vast majority of disease today. Hi, I'm Dr. Jake. I'm a naturopathic medical doctor and integrated physician. On this channel, I share with you how you can heal your body from harmful drugs or surgery. Be sure to subscribe for more videos like this one. Okay, let's jump in. Let's talk about what is metabolic health. What it is appropriately functioning cells. And going a little deeper, it's actually having a mitochondria that functions appropriately. So all metabolism depends upon is a cell that is making energy correctly. So we hear a lot about slow and fast metabolism, right? There are a lot of people out there that are having their cells not work well. So that's down to the mitochondria, the nucleus, and also the cell membranes are very important. And that's what's leading to the vast majority of disease today. Yeah, so what conditions are correlated with poor metabolic health? There are a lot of very common diseases, right? Heart attacks, strokes, diabetes, liver disease, kidney disease, even cancer, autoimmune diseases. All of these things go down to how is your metabolic health? And the interesting thing is, you might feel like everything's going great, but your metabolic health isn't. You might think your cells are really awesome, but they might not be. And you have all these risks of all these diseases that I just talked about, which are the main killers in the United States, right? What are some markers that are correlated to metabolic health? First, it is blood sugar. A lot of different blood sugar tests that we have another one, a fasting and C-peptide. Through doing this, we're able to get a really good look at what's going on with your blood sugar regulation, which is extremely important for your cells to work appropriately and actually have healthy metabolism in your body. Next one is that we look at something called HDL. So if you have telling us that your cell membranes are healthy, that you're able to transfer fluid in and out, that you're able to receive the reception from your hormones and other enzymes throughout your body correctly. So if you have a poor HDL, it's not about, okay, you've heard about this. This means that I'm at greater risk of heart attack or stroke because I'm not eliminating I'm not eliminating bad cholesterol from my body, but it's more than that. It's actually what makes up our cell if we're making healthy fats or not. Kind of correlated to this is triglycerides. And that is a big one that's correlated to our cell membrane health too, and how our mitochondria actually works. So we don't want high triglycerides. If you start getting really high triglycerides, we're starting to see that your metabolic health isn't doing well, and you're going to have all these risk factors that we just talked about. Another indicator of how our body is functioning metabolically is high blood pressure. Oh, it's like, oh, high blood pressure. Oh, that's going to increase my risk of having bad kidneys or a bad heart or whatever. But it also is just a key indicator your metabolic health isn't very good. It's not about just having high blood pressure and then you have these certain risks. It's actually related to that we're actually able to see an indicator that your health is not good. And we need to work on a lot of different levels to really improve your health, because you might have high blood pressure. You don't even feel anything. You feel like everything's good. Just seeing how much weight you have around your belly. And that is basically having a circumference of 40 or greater on men and a waist circumference of 35 or greater in women. Now, the bigger your belly is, the worse it is. You might not have to have a 40. That's how we make a diagnosis of metabolic syndrome. But if you started getting a really big belly, that means we're going to have increased visceral fat, and that's greatly going to increase our risk of disease and really detriment our metabolic health also. Does metabolic health or metabolic syndrome increase with age? 100%. So the older you get, the more your risks are that you have poor metabolic health or metabolic syndrome. Get in menopause, your hormones start getting out of whack, your metabolism starts to not work as well, you start gaining more weight, and that greatly increases your risk of disease and getting metabolic syndrome, and a big indicator of metabolic health. Does it mean if you're older, you automatically have health issues? No, it doesn't, because you could have great metabolic health and be 60, 70 years old if you're taking care of yourself. You maybe feel fine, but you have all these underlying things going on telling us that your cells aren't working how they should. Let's talk about some other markers that might not be something you can actually test for, but are a big one. Is we need to look at, if you're not sleeping well, that's one thing telling me that your metabolic health is not good. Also, if you are extremely stressed all the time, that's another marker that your metabolic health isn't very good. Now, there is a test we could actually do for our stress level and see if it's not working well. Is we could actually test your cortisol. It's called a diurnal cortisol, in which we check your cortisol morning, afternoon, evening, and nighttime, and we could see how your stress is really affecting your body. Also, regarding sleep, a big one that we need to look at is not just getting enough sleep, which we need 7 to 9 hours at least per night, but we also need to rule out if someone has sleep apnea. Because if you have sleep apnea, that greatly affects your metabolic health too, because you're not getting enough oxygen throughout your body every night when you sleep. Those are really the big ones that we should talk about, but one that I like to always put in when I'm checking someone's all these other markers. But if you don't have your thyroid working well, you're not getting the appropriate signal inside the cell to get your mitochondria working correctly. So if you're like have a thyroid that's suboptimal, you're going to have some metabolic health issues also. Why is metabolic health important? The big thing is that we want our cells working well, right? And if our cells aren't working well, it's going to make us sick. It's not that you are deficient of a certain drug, right? You have a certain symptom you're presenting with the doctor, and you just take a certain drug, and that doesn't quite do the trick. You need to really fix the true cause of why you need a certain medication or why a doctor wants to prescribe it, and it goes down to our metabolic health, how our cell is working. And deeper than that is, how is our mitochondria, the working engine that actually makes energy in our body, how is that functioning? And there are certain markers, like we just talked about, in which we could actually see how those markers look at how your mitochondria is working, how your health is, how is that cellular health. And if we improve those markers, we improve your blood sugar, your blood pressure, your triglycerides, your stress, all these type of things, we can prevent so many different diseases. Most of us don't want to have a heart attack or stroke in the future. We don't want to have diabetes. We don't want to have cancer, Alzheimer's disease, whatever. And all these diseases are related to our metabolic health. So that's why it's so important. And you might not know that anything's going on. You might think that you're the healthiest person on the planet. You're running marathons. You feel like you're highly energetic. Your brain works really great, but your metabolic health might be in the toilet because you don't really notice it until it's too late. So that's why it's so important to really dive in, to really get their tests done, to really find out what is your metabolic health. So how do we find out how our metabolic health is doing and how often should we do it? So how do we find out is really, like I said, we don't really have a lot of symptoms. So we need to do blood work. You need to go to a doctor that is an expert in metabolic health, and they're able to order the appropriate blood work for you. And you should be getting this checked every 6 months, in my opinion, if you're over 40 years old. And in the next video, we're going to actually talk about what specific labs that you need to get done. If you want to learn more about what specific labs to do for your metabolic health, click my videos to the right. I'm Dr. Jake, and I'll see you there.